your area of choosing, and there are some that are very important. There are some that you have to choose that are not really important. Nuclear pharmacy and all. So in that first year, we do a series of classes on pharmacotherapy 1, 2, 3, 4, 5. And pharmacotherapy 5 is about oncology. So after they complete, because we do a block system, after completing, for example, oncology, so then the OSCE team, which is the faculty of the clinical pharmacy, the department of clinical pharmacy, they will design a station cases. We normally have four stations. Now, station 1, it may be about you and a medical officer requiring your recommendation. Session 2, likewise, the same thing. Session 3, the same thing. But the last station is always counseling. Maybe a counseling for on how you can counsel a patient on medication, or how you can counsel a patient on how to use a device, maybe insulin, or how to counsel a patient on how to use maybe inhaler, how to do another thing I will talk about later on is what we call MTech. Medication therapy adherence clinic, which is always being run by pharmacists only. So I will talk about that one. Is a future recommendation that I'd like to recommend as well. So now, introduction. Now, each station is always manned by 1 or 2 examiners. In this picture that you're seeing is only 1 examiner with a medical doctor that acts, it's an actor, like medical. Then the person in lab coat is a pharmacist, the student that is being assessed. So what basically is candidates will rotate from, as I said earlier, from one station to the other. After completing one station, you move to another station, you move to another station. So, and the best OSCE stations are curated from real clinical scenario. So most times they always bring those cases from the hospital, that they will just design them so that they can prepare you. What we did in year 1 was that after completing the lectures that we do OSCE, just to prepare us for the second year that we go into the hospital, so that they can assess our clinical skills. Is it good enough? Our communication skills, is it appropriate enough before we move to the real world? Now, let me do a comparison between OSCE and international system that we basically use in Nigeria now. Is OSCE have been shown to have higher reliability and validity than traditional system that we use. And the examiner only observe the candidates without interruption or asking any questions. So this way, the candidate has an ample opportunity to demonstrate their ability and inability, and they'll be adequately assessed. And in OSCE, questions on patient management are captured to follow up, which means, for example, now, the OSCE is very, very interesting in the sense that I can design a case for station 1 and bring that same patient as a follow-up in station 3 or station 4. Like maybe, for example, I put a patient, hypertensive patient, in station 1. I ask you to recommend the appropriate treatment in station 1. Then now, the same patient, and I'll give you the same patient now presented again in station 4, coming up with spike in the BP. So what that one tells you is that it will assess your ability to think, like, okay, how your investigative manner to think for a proper way to manage a patient. Maybe, okay, how do you investigate? Okay, patient came, what's the issue? What happened? Is the patient having issue with the drug prescribed earlier? Or is the patient not taking the drugs the proper way supposed to be taking it? Then you have to use your thinking or clinical skills to interrogate your patient to know what the issues are. So that's what OSCE it's about, just to train you and to see how to improve your clinical skills. Now, OSCE is not an adopted examination format simply because of the traditional clinical exam cannot cope with a high number of students. One thing about OSCE is no matter if you have up to 100 or 50 in the classroom, you can design an appropriate OSCE. But the only thing is OSCE always need a lot of manpower. It's not a one-man show. You need a team to do an OSCE. So OSCE is rather a more standard and more reliable and more valid and fairer means of clinical examination. And OSCE is not perfect though. So, but it is proven as a better assessment tools than the traditional system. What are the benefits of OSCE? OSCE is flexible and can be adopted to test many forms of skills and competency. Number one is communication and interpersonal skills. Now, let me say something about interpersonal skills. I remember when during my internship period, out of all the interns there was a case that we had that the consultant actually added another drug to the patient list of medications, and I noticed that we have 3 different antihypertensive. Why? After interrogating the patient, I realized that okay, the patient is actually having a compliance issue. It has nothing to do with the drugs. After discussing with the deputy director, then she was like, what do you want to do? Just no one was ready to go and discuss with the consultant that prescribed the drug. I just stood up and I went, introduced myself. I'm Ibrahim Azim from the pharmacy department. I noticed that and we discussed, and it was so smooth. So when you train on how to approach in a professional manner, because what OSCE will do is to train you on how to properly approach your fellow colleague in the hospital. And I remember there was a case that the OSCE I did, the first OSCE I did, and it was a case of an angina. I think non-STEMI. I don't really remember very well. So the simulation, the actor, which was the medical doctor, said that the patient presents, I need a recommendation for this patient. I was like, so if the patient is having angina, you did not prescribe anything. I shouted on the director. I actually lost a mark on that. And after the whole OSCE thing, we were doing feedback. Because normally do after the OSCE, they will collect all of us into a room and they will give us a feedback of area that we have as a strength, area that we need to improve on. That's actually one of the good things about OSCE as well. And I was told then that even if you know there is a medication error has happened, you don't shout, you have to present in a professional manner. I learned that from OSCE because I was able to identify that's one of my weaknesses and I improve upon it. So what OSCE will do is it will help you to adequately know how can you obtain informed consent, how can you notify your fellow colleague on medical error, or how you can appropriately do a counseling or explain medication use. So other benefit is it instills confidence. The day I stood up, I saw my fellow interns, they could not, because I know maybe they've not been able to do that kind of thing before, or they're not even, so it instills confidence in students. They'll be able to stand up and do what is necessary. And it prepares students better for clinical practice. It's a training tools. It will prepare them better for clinical practice. And students achieve deeper and more meaningful learning when they do OSCE. Another thing is it facilitates the assessment of psychomotor skills as well as knowledge and attitude. Because I realize most times the attitude pharmacists use to relate with patients by shouting on patients and telling them or using some degenerating words and everything, with the help of OSCE, it will help to train pharmacy in a better way and attitude to use in communicating with patients or any fellow colleague. And it also provide a great platform for student feedback. So feedback from students, feedback from lecturers as well. So one of the drawbacks is that short duration of stations. Maybe you have 100 students that you want to assess, and how do you do that if you don't have manpower? And one thing is a resource intense in terms of you need a lot of staff, equipment, and some clinical laboratories as well. Like you can use a manicure or something doing if you want to use patients as to just design a form of a patient. They also entail a time-consuming preparation. The training has to be done to examiners, including students, and the simulator on logistics. It's a lot of logistics as well. So even some students actually always find it very stressful, and it needs a very extensive documentation and paperwork. So what are the common OSCE stations in pharmacy? As I mentioned earlier, it's always about responding to inquiry. You give a recommendation to medical doctor or physician. And the last station is always about counseling. So you counsel about medical device use, or you counsel about medication adherence. And lastly is there's something called MTech, medication therapy adherence clinic, which is always run by only pharmacists. So from that OSCE, they also train pharmacy on adherence, how to properly counsel patient on adherence. Now, preparation for an OSCE exam, what do you need? Conducting a successful OSCE requires a team approach. It's not a one-man show. You need to form a OSCE team. You need to train teachers. You need to train students. And you need to construct a blueprint as well. It has to be structured. You need to write all those cases that you use per stations. I will give you examples of how to structure, how just a pictorial way of how a station OSCE cases are always look like. And you need to construct a checklist. You need to recruit or train some stimulators or real patients. You can actually get a real patient that will come, both the angry one, both the gentle one. Just put them there. See how your student will react to them, how they will show you their clinical skills. And sorry. So you conduct a full-scale, that is a conduction of a full-scale exam. So this is a blueprint of a tele-OSCE. This was done in 2020, I think 2020 during the COVID. The University of Sabaja, which was the university that I graduated from, did introduce tele-OSCE. And it was so fantastic that we use a Google Microsoft, whereby we actually design a way that there is an assessor, there is a COVID patient that the pharmacy, which is students, need to assess, recommend, or cancel. So it was very fantastic experience. And this is a picture of, that's myself as an actor then. And there was a case about responding to patients concerned on COVID pandemic. So it's basically about patient being as a phobic, and they don't know how to prevent themselves. And we kind of design a simulation whereby we train the pharmacy student then on how to communicate and how to interact with patients in that situation using to Microsoft. Now this is a format of how a OSCE case always look like. So this is a responding to inquiry. As I said earlier, most times station 1, 2, 3 in pharmacy OSCE is always about responding to inquiry, while station 4 is always about counseling. So it depends on what you want to assess them on, that you design your case station on. So for example, looking at this case is Mr. Cordell of 55 years old. People give you the weight. They just give you brief information about the patient. Hospitalized for 2 weeks due to severe pneumonia, then complicated septic shock and type 1 respiratory failure. Multiple antibiotics are basically prescribed, did not give you the antibiotics that was prescribed, and is responding poorly to treatment. So the doctor that is on the medical officer the medical officer need the pharmacist regarding antibiotic treatment is currently waiting in the ward. So which means you will read this first. Do I have it? So it will be pasted on the wall before you enter. So this question will be pasted on the wall before you enter. Once you read this, you just jotted unnecessary information that you need, like Mr. Cordell, 55 years old, diagnosis. That's the only thing you can recognize. And make sure you recognize the name of the medical officer as well. Then you are required to gather relevant information and you answer all inquiry by the medical officer. So there will be a script for the medical officer, the person that is acting as a medical officer. There will be a script. So it's going to tell you, I will show how the script always look like as well, because it's a rigorous something that you have to design. You design the case, you design the script, and you design the marking guideline as well. Now, this is how the case looks like. This is me communicating with the medical officer that needs my inquiry. Then this is how the script always look like. Now, the background is, this is for the medical officer. So the background is the medical officer is holding this. The name of the medical officer is Dr. Rashidi, working as a medical director, and the medical department. So you need an inquiry for AMS team, which the pharmacy is the head of the AMS team. So now you're the one that was sent. That's basically how the story is. You're the one that was sent to answer the inquiry of the medical officer. Now, the opening statement down here is pharmacists you have to initiate the conversation. That is what is expected of the student. That I, pharmacist, I would like to escalate the antibiotic treatment for this patient. That's the opening statement. Now, it's now born on the skills of the student to get out all this necessary information needed. You know, on the case structure, which was this, they did not give you any list of multiple antibiotics they prescribed. They don't give you any other information. This is an ability to test the skills, history-taking skills of the student. So the student now need to implement the history-taking skills to know what are necessary information to take. Like, okay, the student has to ask, what is the past medical history? What's the medication history? What are the medications that you prescribed to the patient within the 2 weeks of hospitalization? Then, after asking that, now the medical officer will now ask, which is the arising inquiry. Look down, the arising inquiry here is that, okay, currently the patient is on IV piperacillin tazobactam. It's now asking you, should I add IV gentamicin based on the CNS results? That's the questions that the medical officer wants you to answer. Should I increase the dose of the current antibiotics? How else should I monitor for the patient response on the antibiotic therapy? So now, after using the skills to get the history and everything, you are expected to answer the 3 questions. And one thing about OSCE is this: reference will be provided for you. They will give you maybe a guideline, or they will give you a BNF, something to take those and everything. So it's now born on you. Another thing that OSCE try to get from you is, how do you use your reference? How properly familiar are you with your references? So that even at that time period, how do you able to check the proper information needed at that period? So that is what another thing that OSCE is trying to assess. Now, this is a performance, this is a grading system. I'm not sure, is this clear enough? Hello? Hello?
Yeah, it's clear. It's clear. I can see.
Good. This is how to check, how to assess the performance of the student. Number one is, if you look at the introduction, does the student greet and inform in a self-professional manner? The way you introduce yourself is very important. That's what OSCE is trying to instill as well. A professional way of introducing yourself. a proper way of introducing yourself? And did you confirm the inquiry and patient name? Patient name in the sense that you don't want to mix one patient to the other. Okay, I said I have 5 minutes left. Okay, I'm almost done. Appropriate tone and gesture and eye contact. That's one of the communication skills. So that is number one, the first thing that you assess on. Then assessment of presenting concern. Did you confirm the diagnosis? Did you inquire about the patient fighters? Did you take the necessary history, like about the antibiotics history, about the C&S result? Did you ask them about the likelihood of non-response to the papers that was back time? Because that was an inquiry. Now, you now be assessed on your recommendation as well. Did you recommend did you give a full recommendation? The first inquiry, did you tell the medical officer about not to add gentamicin because there might be worsening the renal failure? Because you've already asked about the renal function test, that okay, the renal failure is, the function test is somehow, you need to. So did you give a proper recommendation on that? Did you suggest that there should do a sensitivity? Did you suggest if the peptide should be increased? Did you suggest the optimized antibiotic by administering to another route of administration? Or did you give a proper monitoring after you give a recommendation? Monitoring is always very important. How do you monitor the response of the patient? So then did you have a good closing as well? Did you invite the medical officer for follow-up questions? So those are very, very important as well. Now, so I won't go into this one. This is just another structured station case. This is a case of pneumocystic carrying pneumonia. So this is a case of pneumonia. It's also an infectious disease case. And this is a script for the patient. This is you interacting with the patient now. And it's more like a structure of the last station. You know, I said earlier, station 1 to 3 is always responding to inquiry. The last station is about counseling. So like this patient now, you are asked to counsel a RVD patient on starting of acts, if the patient can start acts or not. So you ask all those follow-up questions and everything. So what to achieve with OSCE? It will boost patient pharmacy confidence. It will improve your communication skills. It will help to assess the strengths and weaknesses, and it will improve clinical skills and promote interprofessional relationships. So now, my future recommendation would be if SIGPAN can also spearhead the development of medication therapy adherence clinic. Maybe in future, hopefully, I can talk more about what it is. It's a clinic which is only run by pharmacists. It's a clinic run by pharmacists. And when there's an issue with, in Malaysia, they have a system whereby when they notice there is an issue with adherence with a patient in the ward, they will just write on the case, refer to MTech, which means they will be referred to the clinic where pharmacists head, where they will do a proper counseling, the protocol on how they do the proper counseling. If I'm invited, I'll be glad to talk more about it as well. And another one is home medication review, whereby it's for special population, like a geriatric, whereby they go to their home, see how they store the medication, see how they take their medication. It's about making sure patients have a good outcome. So so that's the end of my presentation. Thank you so much. I hope if there's any question, thank you.
Thank you very much. We really appreciate the extent you have gone to give the detail of this. I do not intend to give a summary of what you have said. I'm going to leave it for the people to discuss. However, time is well spent, so we shall quickly go into discussion. And I'm going to call on Pharmacist Idoko Anthony, the FPSN and the staff of Pharmacy Council of Nigeria, to start a discussion. And you have between 5 and 10 minutes to do so. Thank you. Pharmacist Idoko.
Thank you very much, Dr. Demola.
Thank you, sir.
I want to start by appreciating the SIPAN leadership, ably led by Dr. Madu, for this opportunity to be part of this program. I equally salute all the fellows and colleagues that are here listening to the program. The guest speaker has actually given us kind of open check on what OSCE means and how he think we could apply it in our own environment. The first thing that came to my mind when I was nominated as one of the panelists on this was, how are we going to look at this with respect to our environment, and how are we going to apply it? But the truth is that it's something that we could apply in our setting, because it's been working in other places. The only area I think we have to take a greater look at is bringing it up as part of our CPD program, continuing professional development program, as suggested in the topic. I took my time to look at OSCE in other places where they've been implementing it. And for now, of course, it seems to be more widely applied in school. Like the speaker told us, of course, it's a format of examination that enables students to be evaluated in a uniform, standardized, reliable, and objective way. And if we look at it, yes, this is the time to start thinking of it because of the PharmD program that gives us room to go more into clinical area. But I think we should start looking at it as something that probably our lecturers in the schools could start seeing as one of the ways they could use in training of our students, in assessing our students, especially at the clinical levels with the PharmD program. And I also observed that when you go through the SWOT analysis of this program or this assessment, you discover that yes, it's actually something that is very, very good, and something that we should be looking at. But again, the peculiarities of our environment are things that we cannot ignore. Because the speaker talked about the requirement of manpower, the number of stations, the settings, and all that. And when you look at the strength of this program, you talk of its objectivity, you talk of its authenticity. We said it's reliable, it's a valid way of assessing people. But one area that we have to also look at is the weaknesses, which include its cost in terms of time, in terms of effort needed in conducting this kind of assessment. And it also requires large space. Like I said, it's not as if it's not doable here. but it requires a lot of commitment, a lot of synergy, and team spirit for us to effectively implement it. And also, looking at it from the opportunities that it provides, which of course include replacing the traditional system of assessment that we use today. Yes, it's something that is quite objective and gives one that opportunity of experiential kind of assessment whereby you are seeing what you are doing. But again, I also want us to look at the threat, which includes probably the natural opposition that we could get from the traditional evaluation that we normally do. But in all this, my thinking is that if we could first start this in a structured system, in the university system, where we have the lecturers, they imbibe it as a way of assessment, clinical assessment for the training of their students, it might be easier for us to incorporate it into our continuing professional development that we do, because the structure of our continuing development program for now is such that it may not be easy for us to think this way at the moment. However, it all depends on our commitment and the team spirit we share to be able to do this. But in all, I think this is a very good way to go when it comes to assessment, clinical assessments, especially now that we're going into the PharmD program. Thank you very much.
Thank you, Dr. Idoko Anthony of Pharmacy Council of Nigeria. We have heard from the regulator. Let us go and listen to the teacher. So we shall go back to the classroom, and I will be calling upon an associate professor of clinical pharmacy and Dr. Ariola Joda of University of Lagos. Madam, the floor is.
Thank you. Thank you so very much. And I will say good morning to you because I'm right here in Australia for FIP conference. And it's good evening to all of you in Nigeria. I found it a very interesting topic when I was asked if I could serve as a discussant, so I tried to prepare myself around being available. So I'm very glad to be here. And thank you, Dr. Hazib, for such an excellent presentation. You have more or less done our jobs for us because everything that we need to then discuss is already well presented. For me as a teacher, an OSCE is an exciting prospect. In Unilag Pharmacy right now, we do what we call simulated pharmacy as part of our clerkship, where as part of that simulated pharmacy clerkship, we have students in various stations as part of the training, but we don't examine them, and then they're not rotating through those training as an exam option, but we rotate them through those stations to learn. So in one station, they're learning, in one rotation this week, a portion of students are learning compounding and doing it practically. That's the same set next week could be doing drug communication skills or prescription review, or so to be able to then see how we can put this into an exam format would be challenging, but it would be an interesting thing to do. Dr. Idoko mentioned our environment, and I say that, well, and just as he also concluded rightly, it depends on what we commit to do and what we want to do, because till tomorrow, medical students have been doing OSCEs in all the faculty, in all the universities across the country, and it takes all the you know, we all know when they're having exams, all the lecturers are also very busy because they are all assessing these various stations, you know, so it's not something that is impossible to do. To implement it in pharmacy, for a few people that I was trying to see whether there was any bold school that had actually started an OSCE in Nigeria, in Africa, and it looks like none of us have, because I'm sure one of the major issues will be the labor intensive nature of it. You need faculty to be first faculty to be trained themselves, and then to be able to provide that objective assessment of what students are doing. You know, so it's doable. It will be challenging, but it's something that we can begin to put on the drawing board, especially as Dr. Idoko has also said, because of the ongoing PharmDs that the various universities are changing to or have initiated. You know, so to have it as part of our assessment. Dr. Azib mentioned that first year, you know, at the introductory, what we can call the introductory pharmacy experiences, the IPP, is when students are learning the didactics, they are learning the theories behind the therapeutics, they are learning the theories behind the formulations and the various dosage forms. Then in preparing them for that clinical stage, we can use that OSCE to test their performance, to test their confidence, to test their communication skills and all that. Under FIP, I did a 1 month, excuse me, I did a 1 month observation at the Robert Gordon University in 2018 in Scotland. And while I was there, they had some sets of OSCEs. And it was really very interesting to me because you had these simulated patients. Many of them are patients from the hospital that have taken on this responsibility to serve as patients in the faculty. You know, so they come, as Dr. Azib mentioned. You know, you have different kind of patients. There were some very old women that have been doing it for a while, and they could create indignation. I've been here, you're not attending to me. And you know, so, and their job is then to provide feedback to the faculty, because while there's a challenge of lecturers everywhere, it may not even be a Nigerian problem alone. So they couldn't have faculty at each station. So those simulated patients were also part of the assessment. So they were giving feedback to the lecturers at the end that formed part of the scoring for the patients, because they didn't have enough lecturers to be at each of the stations. You know, so it's something doable. It will be interesting, it'll be challenging. And I'm sure that especially if a directive begins to come from the regulator, from PCN, for institutions to begin to look in this direction, and then to add it on as something that could form part of assessment, accreditation, maybe in 5 years, in 10 years, you know, give a kind of rollout plan for it to happen, then it may come in better and faster than if it is left to each of the schools to decide at what time or at what pace that they would want to do that. And then for those of us already in practice using OSCEs, I think it will be very relevant for the residential program for the residency program that is already going on in Delsu. You know, so at that level of training for residents, and at the level of the West African Postgraduate College of Pharmacists for the residency programs, we could see how we could incorporate OSCEs into the assessments. Thank you very much.
Yeah, thank you, Ashe Prof. Ariola Jordan. Thank you so much. We now go to the community, and then we shall be talking with Pharmacist Folashade Lawal, the Director of Victory Drugs, Lagos State. Pharmacist Folashade, the floor is yours. Hello, Pharmacist Falashade.
Looks like she's out.
She has been
Not
having
on the
issues
call,
with
right?
network. My co-moderator, can you take the floor, please? While we wait for Pharmacist Falashade.
Okay, I'm back. Sorry, I got locked out.
Welcome.
So sorry, my internet has been very epileptic. It rained cats and dogs here today, so it's affecting a lot of things. Let me just briefly show my face, then I'll go back. So good evening, distinguished colleagues, and I want to thank Dr. Madu for this unique opportunity. When he invited me, I was wondering what is going to happen. I'm just a community pharmacist. But having listened, there's a lot of potential in OSCE, and I think that it will help us in coordinating IT training and also intense training, because for now we just have our own ways of doing it. With this, we'll be more coordinated. It will enable us to assess them better. And like all of us have spoken and agreed, we'll love for the regulators to come in here, train us on what to do, and then we can always step down this training in our various facilities. For example, there were times that we had up to 4 or 5 interns, and we tried to assign them to various things. So if we are simulating and then assessing, I'm sure by the time they're done, it will be a lot better for it, because we do this home care too. We do compounding, we do a lot of attending to patients, and it will just be a good way to assess them, to help them to be prepared for what is ahead. And I'm sure it will take pharmacy to a higher pedestal if we implement it here in Nigeria. I really can't wait for us to get there. Thank you, Dr. Azib, for that very enlightening and eye-opening thing. We do them in a not so structured way, and we need to start thinking of doing them in a very structured way, so that at the end of the day, we'll have pharmacists that are happier, because it's more fulfilling when you are meeting needs, and this is the need of people. So for me, it's a very great thing. I'm really looking forward to it. The little I've learned, I will start in my corner, waiting for us to do better with it, waiting for the regulators to lead us in a better structure. And I'm sure there are some of my community pharmacists here too, looking at it, because in the community, yeah, we may have our own peculiarities and challenges, but we are faced with these conditions from time to time. And we also have collaborative platforms. We work with other healthcare professionals. We coordinate care of patients. So we also need this in the community setting. It's not only in the hospital setting that it will work. So I'm really looking forward to us structuring this properly, depending on the areas of practice, and encouraging the young ones with this. For now, what we just do are cases, we give them cases to analyze and all that. But if we have simulations, I'm sure it will make it better, more interesting, and then properly structured. So I really can't wait for us to start this. Honestly, it's very interesting, very exciting. And like I said, for me, I will start small in my corner and see how much of this that we can do, and then we document and take it off from there. Thank you.
Thank you, Pharmacist Olashade. So, my co-moderator, can you please take it from here?
All right. Thank you so much. Thank you, wonderful discussants. We have had a very, very interesting night's discussion ongoing today. One of the key points I gathered here today, that one of the things we want to achieve having this OSCE is that it's going to help to promote interprofessional collaboration within us and other healthcare professionals. And that's what we actually want. Just like Pharmacist Folashade Lawal said, we want a more, will I say, happier pharmacists. We want to do the things that will make us happy. And reaching out like this will definitely make pharmacists happy, because they know that they are actually relevant where they find themselves. So at this point, we'll take few questions. Some persons wants to be clarified more on this, and then questions can be directed to either the discussants or even the guest speaker. Anyone can direct our questions to them. But for me, I wanted to ask the guest speaker, you said the OSCE examination could contain about 10 to 20 stations, and each station lasts for 5 to 20 minutes. If you put that together, that's a lot. Although you did mention that OSCE is not a one-man thing. It involves a lot of manpower. That's a lot again. No wonder the PCN representative from our system, Anthony, did mention that in Nigeria here, I don't know. But again, Professor Joda also mentioned that this has been going on among the medical practitioners. So that means it can work with us here in Nigeria. Some of the most common OSCE stations are responding to queries and also counseling, and is what we are already doing. But it's just that we've not gotten any structured way to record these things, and that is what Mrs. Folashade Lawal just mentioned, that already she will start from her side, pending when this training will come on board, so that we begin to use the structured forms. I tried, when you were presenting, my guest speaker, when you were presenting, I tried to screenshot one of the forms that was that you put down there, that you personally were actually involved. I screenshot and sent to the platform, so that some persons will see how it actually looks like. Case summaries, lab result interpretations, past encounters, and counseling, taking history. These are what the stations contain. So some of us would like to know, because you said a group of station can form a circuit. So some of us will love to know how successful it has gone there, even though you did mention that there are some barriers, there are some setbacks, I mean. So at this point, we want to welcome one or two comments, questions, contribution from any of us, and who you want to direct it to. So the floor is open. You can raise up your electronic hand so that we can call you. Okay, thank you very much, Pharmacist Felicia Williams. Please, you have the floor. You can unmute yourself and make your comment, contribution, or question.
Good evening, all. I want to appreciate the speaker and the discussants. One of the benefits to pharmacists and to the patient is optimal patient care. When we have optimal patient care, then our relevance will become optimal also. So it's not just pharmacists being visible or more collaboration with other healthcare givers. We also want to look at optimal patient care as one of the benefits of OSCE. Thank you.
Yeah, thank you very much. Thank you. I think that was also mentioned among the one of the benefits of OSCE. Let's have yes, Professor Ariola Joda, you have something to say. Please, Ma, you have.
Thank you very much. I wanted to respond to your own queries and comments, our moderator too, on the number of stations. Well, I believe Dr. Mazib gave, I guess the maximum ranges. Even though it could be, as I said, 10 to 25, but usually most OSCE stations are between 4 to 6. OSCE cycles are between 4 to 6 stations. So you could have more than one cycle per day. So for instance, you can do one cycle on an infectious disease posting for day one for for that particular cycle. So the first step could be looking at the prescription and responding to a query on an adverse event or something. The next stage or the next station could be what you would recommend if you were faced with XYZ. So 4 stations or 5 stations like that make one cycle that would form a complete exam, so to speak. The next day you could come for another cycle. Could be something on chronic critical care, or so that at least maybe in a two maybe in a week or a 2 week period, you could have different cycles that the students have to go through to make up the entire exam. Or it could be just one OSCE, depending on how the institution decides to mark it out. But it's very true that it is human capital intensive. But if we're able to get to that point where we can collaborate with ourselves within pharmacy, so we can bring on for instance, if we want to start it in a particular institution, let me use UNILAG for example, because we have collaborations already with where we send our students to from us in UNILAG. We send students to the psychiatric hospital. We send students to the Lagos State University Teaching Hospital. And of course, students also do SIWES in hospital and community pharmacies. We could pull facilitators or assessors from these various facilities to assist, so that it's not just academic people that are assessing, so that's a possibility. That's one way of expanding the human resource pool to be involved in assessing the students, because one of the key things about an OSCE is that you're just simply observing. You're not correcting. You're not coughing when the student wants to pick chloramphenicol instead of chlorpromazine. You are just observing, simply observing and recording your observations, and that forms the assessment for the student. So that's one way to improve the pool of facilitators. Another thing, responding to just commenting on what Pharm Lawal mentioned about OSCEs in community pharmacy. That would be so nice if we could arrange with some pharmacies to have some stations happening in those places where the students have been introduced to various things while they were in the pharmacy, and then they are expected to meet these various stations and carry out appropriate services, and that will be assessed to show that they have really learned what they were there to do, whether it's at IT level or at internship level. That could also be taken on board. Thank you. So just to add to those comments, thank you.
Wow, thank you so much for your contribution. It's well noted. Thank you. I also wanted to mention this to my national chairman, SIPAN, Dr. Joseph Madu. Sir, I know your hands are up, but this question is even directed to you. We wanted to find out, at the conclusion of his presentation, he did mention that he has some recommendation, and then the recommendation is on medication therapy, then rest clinic which is run by pharmacists only. So he was saying that he's even willing to come again to talk again about this and how CPAN can handle it here in Nigeria, extend it to other places. So what do you say about that? And I also want to recommend, I don't know, when I see this OSCE, I think we should also have another time, we have another discussion about this, maybe a part 2, for some of us who may not be so clear on this issue. So Dr. Madu, please, you have the floor.
All right. Good evening once more, everyone. Sorry, everyone, because the night has been deeply spent. Dr. Tim, if you can hear me.
Yes, I can hear you very well.
All right.
Loud and clear.
You are talking about medication therapy adherence clinic, or what he called them tech or so. I don't know if I got it properly. But then probably before I go into that, I like both Dr. Idoko, Folashade, and Dr. Joda. They all approach settings. If you observe from what most of them emphasize, apart from what Folashade said, that she will also start in her own little corner. Most of including the presenter herself, the emphasis has been much on testing students and patient care skills, or the way they offer pharmaceutical care and pharmaceutical services. But one thing that really piqued my interest in this topic was, of course, Dr. Hasib made this presentation. I know he made a kind of suggestion to do I call him former chairman of PCN Council, former chairman of council, Pharmacist Ahmed Tijani Mora? Has he made a recommendation to him when we had the lecture on certificate of pharmacy education? That was when Hasib made this. Yes, hear me, sorry.
Okay.
Hello?
Okay, you're going downstairs.
Hello, sir.
See, of course, then come and carry this.
Go ahead, sir. Let me
we can hear you.
Okay, sorry. Yeah. So I said that the presenter tonight mentioned the OSCE, and we are all interested in it. And so we started discussing with him. It's exactly almost 1 year now that we had this discussion, and today, to the glory of God, he has made a presentation. So as I was saying, most people emphasize on a way of testing students, but we in CPAN are looking at it as a way of testing clinical skills, not just of students, but of even practitioners. There was something I saw somewhere that you can't go to something that's being tested, and the testing must be through OSCE. So it's not for students alone, but for professionals, either graduates of nursing or graduates of medicine. I don't know about pharmacy, but they emphasize nursing, that if you want to practice in the UK, they must test your clinical skills through OSCE. So that means you're no longer a student. So you're no longer a student. So when Dr. Folashade was saying something about starting in her placement for her students or interns, and I think Professor Joda also mentioned residents. Yes, of course, residents are all graduates and they are doing residency. So we look at, that's what we are looking at, even in CPAN, that we can start looking at testing colleagues if we are even in our own little corner, just like the way, because we are involved in professional learning and development. I'm not talking about the MCPD by PCN, but I'm talking about professional development, whereby we learn and we continue to learn maybe it's a mini OSCE now that I'm thinking about. Sometimes we look at standard ways of doing things. We look at testing, we test people's skills, clinical skills, and to find out if they are doing it well. Then finally, coming to what you have seen on is it Tech or something, the one that is run by Pharmacists alone. Usually, everything we ever hear about in Japan, we normally note it down and we don't forget, except maybe we may not have time to do that, but we always want to improve and implement. So I assure you that we shall continue to dialogue with relevant stakeholders. And Dr. Hazib may still need to come again next time to give us some lectures on this so that we understand better. And we are very happy that we are working with a lot of our relevant stakeholders, all for the betterment of pharmacy practice in Nigeria. I don't know if I'm clear enough. Thank you very much.
Yes, you are very clear, sir. Thank you very much. We really appreciate you. Thank you, sir. So at this point, I will take our announcement. We are about rounding up. Our time is fast spent. We'll take our announcement by Dr. Issa Abdumunu. Dr. Issa, please, you have the floor.
Dr. Issa? Is Dr.
Issa there?
Do you know why Dr. Bello's hand is up?
His network
is
okay.
Okay, that's right.
Dr. Isa put it on the group that his network is erratic, so I think it's off. He said it's heavily raining in his area.
I let the secretary do the announcement then.
Chairman, any announcement where we have the meeting of our desk officers, the specialty groups desk officers? We have a meeting coming up on Sunday. So this is to tell them that we expect all 35 desk officers to be at that meeting promptly, as we have issues of paramount importance to how we can be certified to discuss in that meeting. Okay, and that's the announcement I can think of now, other than to thank everyone for coming up. But I think the vice chairman is taking the vote of thanks. But for my own part, I would like to say a special thank you to the presenter tonight. In fact, I've added a lot to my body of knowledge. I don't think I've had anything hospital before, though I have a daughter in the medical school that from what they described, that is what they usually do here. And that is in Nigeria here. So by the time we start saying we don't have the facility, we don't have this, we don't have that, as Professor Joda has said, it's something that we can do if we really want to do it. And from Folashade, I've told that on our own part, she will start from our own area. And that is what I will implore all of us to look into, how we can start from our own place. The same when you are thinking globally, act locally. From your own local, what can you do? Is this very popular woman that said, find your own Calcutta. Find an area where you can make impact. So for Dr. Azib tonight, from me personally, I'll say a big thank you to you. And for Dr. Madu, the man who continually see tomorrow, because when they first started this thing, honestly, I had no idea. But listening to everything tonight, no, I know we must have a part 2 and part 3 and part 4 even till we get there. Thank you all.
Yeah, thank you so much, our National Secretary. We appreciate you. Thank you so much. So now we are almost rounding up, we want to have our vote of thanks by our National Vice Chairman, Dr. Maureen Wafo. Dr. Maureen, yeah.
Okay. Good evening, all, once again. And on behalf of our National Chairman, Dr. Joseph Madu, FPSN, I want to appreciate our dear guest speaker tonight, Dr. Ibrahim Opayemi, and the panelists, Dr. Anthony Idoko, from Fellow Sadeb Lawal, and our Associate Professor Arinola Jordan, for a wonderful presentation and discussion to this topic. I want to also thank our moderators, Dr. Suleiman Ademola and Dr. Tripure, for an excellent moderation tonight. I'll not forget the audience that have been on up to this moment, a few minutes to 11 p.m. We are still here, just because to learn. Thanks for joining tonight for us to mark our World Pharmacists Day 2023. We have learned a lot concerning this OSCE today, and I encourage all of us to still go back and read more, because I know this will help us as clinicians. It also help us in teaching and assessing our students. Those of us who work in the teaching hospital, we still teach and assess our undergraduates that come to the hospital, likewise those in the community. So it's a good one for us. And I pray that we'll continue to read more about this and particularize it. I know it will help us in improving our student clinicians. Thank you so much. And I pray that we'll continue this next time. Our guest speaker will appreciate you. God bless us all. Good night, everyone.
Yeah, good night. But before we say good night, thank you so much, everyone. I join my voice to thank everyone, our wonderful discussants, our wonderful guest speaker, the National ESCO, our professors, our fellows. We thank you so much. I recognize our flying officers. I can see them on the platform too. Thank you so much. At this point, we want to have our closing prayer by one of our flying officers, Ibrahim Amidu. Our opening prayer was done by a Muslim. Okay, let's have our flying officer give us our closing prayer. Thank you all so much.
Okay, good evening, everyone. And thank you for the opportunity to give the closing prayer. So we're in prayers. In the name of God, the most merciful and the most beneficent, we thank the Almighty God for bringing this meeting to a successful end. Indeed, we have learned a lot. We pray that all that we have learned will be a provision for us and not against us, and may have direct impact on our patients and healthcare generally. Amen.
Good morning.
Thank you. Thank you so much, everyone.
Bye.
Thank you.
Yeah. This presentation is
Bye,
available on
everyone.
our CPAN YouTube channel. We can log in, subscribe, share, and like. Thank you so much. Good night, all. Sweet dreams.
Good night.
Night.
Good morning, Dr. Joda.
Okay, yes, so Dr. Jordan,
Good
please.
morning.
Good morning, Ma. Have a
Bye.
lovely,
Good morning,
lovely day in
everybody.
Australia.
Nice time.
Morning,
Bye.
Dr.
Well
Jordan.
done.
Morning,
Bye,
Professor.
everybody.
Bye.
Thank you.